Well, tens of thousands of our neighbors will no longer have access to their doctors under the Affordable Care Act. That's because the largest and most affordable carrier, Blue Cross Blue Shield, has pulled out of the state exchange. New at 10, News Channel 5's Rebecca Schleicher joins us with how the ever-shifting healthcare landscape may affect us all. Rebecca.
Yeah, Rory, it's really an uncertain time for a lot of folks. But right now here in Middle Tennessee, there are two carriers left, Cigna and Humana. And you can see some of these numbers for premiums, they might hurt. Rates have gone up 40% since last year, though most people who qualify will get subsidies to help with those costs. It's a time of major uncertainty in Middle Tennessee.
It's a huge blow, so what do we do? And that's the big question.
With Blue Cross Blue Shield out of the healthcare exchange, so are many doctors and hospitals.
81,000 with all the surrounding counties no longer have access to Vanderbilt and St. Thomas today. Will HCA be able to handle that capacity? They say they can.
Frustrating, yes, it can be very frustrating.
This is a group of navigators, the people who help folks sign up for healthcare, and they have a lot of questions for the insurance companies before open enrollment begins next week.
What is the wait time that is okay? Is it 3 months? Is it tomorrow? What do you do if you're sick?
But today, not a lot of answers.
It's absolutely going to be a challenge.
For the providers sticking around, premiums are going up 40% in the Nashville area.
HHS will come back and tell you that based on their statistics, I think upwards of 80–85% of the people that purchase in Tennessee get a substantial subsidy that may reduce their premium prices to $100 or less, but that doesn't account for the other 15%.
They say it's because too many sick people signed up without enough healthy people to help balance the costs.
The people that are sick with chronic conditions. It's not something that goes away overnight. It's not a broken arm that goes away in 6 to 8 weeks.
And while many in the industry believe the system will eventually stabilize and the major hospitals should one day be a part of the networks again, they say it could be rough going till we get there.
You're going to have to be an advocate for yourself this year. For the first time, our opportunities in healthcare are shrinking.
Now, when I asked what the most important thing you can do was today, everyone told me the same thing. Go online, research your doctors and what networks they're included in. If the networks that are currently on the exchange don't include your doctor, you may need to start asking around and finding a new one unless things change soon. Reporting live, Rebecca Schleicher, News Channel 5.